Hey there. Today we've gathered some of the internet's most pressing questions from the likes of Reddit and some other locations that hopefully Dr. Short can shed some light onto, a licensed psychiatrist.
And Connor heard the podcast and found me, reached out to help out. So very, very much appreciated. It's been a good last year and a half trying to build this YouTube channel. So appreciate everything that you do.
Thanks. So without further ado, let's get into some of the questions.
Or, put more simply,
If you need help like this guy, call your own doctor.
So the first question, what is the craziest medical condition you have ever heard of? The first responder says the Capgras delusion. The person becomes inalterably convinced that someone close to them has been replaced by an imposter who has disguised him/herself so cleverly that they look identical to the replaced person. Yeah, this person looks and acts exactly like my wife and knows everything about me and what my wife would know, but she is an imposter disguised to fool me, and I will have nothing to do with her.
Yeah. So some of the delusions that come secondary to primary psychotic disorders or just a lifetime of stress and trauma can bring about delusions, or there are sometimes organic causes. Capgras delusion is certainly one of the wilder ones where you feel like somebody's been replaced. Something similar that I've seen a couple of times is a condition called pseudopsiesis. It's a similar delusion based in the fact that somebody thinks that they are pregnant, despite the fact that every imaging modality, lab test, pregnancy test is negative, but it's such an embedded belief. Sometimes it can occur with people who struggle with bipolarity or bipolar disorder or manic depression in their manic phase. This idea of being impregnated by either a celebrity or by God or by Jesus or some other deity. That is something I've seen a couple of times. Probably the craziest medical condition that I've ever heard of is a type of conversion disorder. And I heard about this from a great doc that I used to work with, Dr. Frierson, who has since retired, best bedside manner in the city of Louisville, the state of Kentucky, maybe in the world. Dr. Frierson just can't emphasize enough how much I learned from him. But he told me the story about something that's called a conversion disorder or a functional neurologic disorder, where a gentleman who had been involved in, I don't know if it was the priesthood or some other religious organization for the majority of his life, had finally retired and left the priesthood or the monastery or whatever it was, had a strong moral compass and moral sense, but I guess drove by a Catholic school and had some automatic thoughts come in that were intrusive and probably sexual in nature. And since that happened, he developed blindness. This is not a, temporary or a faking it, which a lot of people believe. This gentleman went to learn Braille. This gentleman got a intense, neurologic workup, ophthalmologic workup, the workup on his eyes, and they couldn't find anything wrong with him. Like I said, learned Braille and lived as a blind person for nearly 2 years until he and Dr. Frierson worked through it in their therapy. He regained his sight. I think it was somewhere between 18 months or 24 months later. So that's probably the craziest. And I do call it a medical condition, even though we don't know why or how it happened. People don't fake these things. Are there people who fake symptoms? Absolutely. But a true conversion disorder, somebody's not aware of it consciously that they're doing it. It's a way that their mind or their brain tries to escape in their environment. So, but that's definitely the most severe degree that I've seen somebody go to try to address the symptoms in terms of becoming totally blind as a unconscious or subconscious reaction to improper or impure or immoral thoughts.
And really quick, before we continue, we would love to do this again. So if you guys could possibly drop some questions down below that you think Dr. Short could answer for you, we would love to have some more questions to go into the next one that are specifically tailored to you guys. And if you are enjoying the video, please make sure to drop a like and subscribe. It means a ton to us. Thank you very much. Okay. So for our next question, this is from a Reddit called Explain It Like I'm 5. So the person asks, explain it like I'm 5. Therapist versus psychologist versus psychiatrist. What's the difference? No matter how many times I Google the difference, my brain just doesn't comprehend it. LMAO.
So I would say the best way to organize it internally would be by length of training. Psychiatrist is going to have undergraduate, college, and then they're going to go to medical school for 4 years, and then they're going to go into a psychiatric residency or training, on the job training for 4 more years, and then they become a psychiatrist. So that's a long road. You learn a lot. You learn about medications and how to prescribe them. Maybe we don't learn enough about when not to prescribe them. A psychologist also goes to undergraduate and then has to go to psych grad school with clinicals that follow. And in most states, psychologists do therapy, or sometimes they'll do psychological evaluation for diagnosis. Most places, they do not treat with medication. They can prescribe behavioral techniques. There are a few states that allow some loosening around prescribing with psychologists, but they are very highly trained in how to do therapy and all the different various forms of therapy. I got some of that training as a psychiatrist, but it was not super emphasized. It was more like a half day a week for a couple of years was my therapy training. And then a therapist, they do similar things to a psychologist in a lot of ways, but they don't have typically the same type or duration of training. Sometimes social workers will become therapists and they have a lot of pretty similar training. But then there's other forms of becoming a therapist. Some people would call those individuals counselors. A psychiatrist could be a therapist. I certainly operate as a therapist with some of my patients, but also somebody who's gone through, for example, a drug rehab program and come out the other side sober or in a good place. They can then become a certified counselor. I don't remember the credential specifically, mental health something counselor. And they can essentially provide therapy or counseling on, that specific fighting through drug or alcohol or any other addiction. But psychiatrists prescribe meds, psychologists do therapy, and therapists, I would say, more do counseling, which is weird to say, but yeah.
Our next question is in r/mental health. Is anyone else scared to talk to a therapist/psychiatrist because you'll end up in a psych ward? The person says that they know that they could benefit from seeking professional help. Couldn't we all? And getting a diagnosis, but they're worried that if they tell the psychiatrist the truth, it could ruin their life by being hospitalized.
I think the biggest priority is to make sure that that individual is safe, right? And that they're not at a true risk of dying by suicide or dying because of some sort of psychosis that is driving their behavior. What I would add is that I think generally people believe that if they tell their provider that they're having suicidal thoughts, that means they'll end up in a psych ward. Suicidal thoughts are really, really, in a way, normal to have. I've seen figures upwards of 50 and even 75% of people dealing with some sort of suicidal thought in the past. Now, if somebody is truly suicidal, has a plan, is kind of imminently trying to figure out how they're going to do it, and they tell me that, then I would seek out a psychiatric hospitalization, because all this stuff about ruining your life is irrelevant. You're not going to necessarily have a life. So it's definitely a judgment call. Like, if you go see a therapist who is their first day on the job and they're very, very worried that they're an imposter, or that, something terrible is going to happen to their patient, then you may get stuck with the wrong person that sounds the alarm when it's not necessarily an alarm. Like, if somebody's just having a intrusive thought about suicide and they have absolutely no frontal lobe or conscious desire to do anything about it. So yeah, I mean, I understand people being afraid, but also if your symptoms are serious enough, you've got to find an outlet for that. Even if it's somebody just to talk to and try to work through a plan for how to address the problems in your life, or the suicidal thoughts that, you're having. But I would not let fear of ending up on a psych ward. If you need to be on a psychiatric, inpatient hospitalization, that's one thing. But in my 10 years, I have walked two people to the inpatient psychiatric ward when I was in an academic institution, and they were both agreeable to going. Other than that, I have not put anybody in the hospital against their will.
People have read it who have had awful psychiatrists or therapists. What are your horror stories? I'll read off one of the responses to this question by Wildcat57. I went to a psychiatrist when I was a teenager. I was under the impression we would be talking about what was bothering me. The whole appointment was 15 minutes long, and all he did was prescribe me an antidepressant. Call me crazy, but the people who work in the mental health field should absolutely probably start by talking to the patients and not jumping straight to sketchy and overprescribed drugs.
I'm looking at the comment below that. Unfortunately, that was the intention of whomever sent you there. A psychiatrist is just a medical doctor that prescribes meds. You should have gone to see a psychologist first for talk therapy, leaving it up to the therapist to suggest meds. Sounds like you were diagnosed with mental illness before anyone took the time to hear from you. I'm sorry you were treated that way. That's probably fundamentally the biggest problem, is just when, and I'll focus more on psychiatrists, when psychiatrists don't listen to their patients. Awful psychiatrists definitely exist, but not listening to what your patients are saying, or if you're challenged by what your patient is saying because it's not a typical response to a medicine or not a typical side effect to a medicine, there's a desire to want to put the onus on the patient. Again, I think it's a subconscious desire, but you've got to listen to the person. You've got to understand the individual. That's one of the biggest problems with psychiatry in general, is just treating people like there's some sort of algorithm or flow chart or guideline. Everybody's unique, and it takes time, energy, and effort to understand what somebody is dealing with internally, that based on their ability to trust you, their ability to kind of scrape away at the subconscious over time and try to put the pieces together about why their mind functions the way that it does. Also, psychiatrists are people who don't see their patients as humans or as fundamentally equal to them. Because if you don't see your patient in the same light as something you or your loved one could deal with, I think it just limits the empathy that you have and your ability to connect and create rapport with that person. And then the last thing I'll comment on, no psychiatrist should be doing an intake appointment in 15 minutes. I mean, it doesn't matter if 10 other people before me that refer somebody, a patient, say, yeah, they need to be on a medicine of this or that sort. I need to take a fresh look. And an hour's an absolute minimum. I mean, let's be real. Like, we're complicated. We're simple in a lot of ways, but like, the story is complicated. And figuring out the right way to help somebody, whether it be medicine, again, psychiatrists do therapy. It's not that psychiatrists just prescribe medicines. I wouldn't be here if that's all I was doing, 15-minute appointments and just shelling out meds. That's not very rewarding, I don't think. I think a good psychiatrist uses all the tools available, whether that be including other therapists or counselors or family members in the person's treatment if they're willing, or using medication when it's warranted at a low dose with consent from the patient, knowing at least as much as I know about the side effect profile and the potential side effect profile. But I think just, those three, not listening, not seeing your patient as an equal in a fundamental sense, and then just doing what the guidelines say you should do. I think that combination would create one of the worst psychiatrists. Again, that's outside of people who are doing immoral or even illegal things.
This one is from Juliet Jane 01. It's kind of funny, kind of not. The doctor says, "You look great. How did you lose weight?" Her son says, "I have an eating disorder, anorexia." The doctor says, "Well, keep doing whatever you're doing. It's working great."
It sounds like a joke to me, a little bit of a sick and twisted joke, especially if you struggle with an eating disorder, anorexia, bulimia, binge eating. But I think as a mental health provider, like especially meeting somebody new, it's one thing if you have rapport with someone and you can joke with them and you've established that. But in terms of meeting somebody new, I was taught to ask a lot of open-ended questions, not yes, nos, not leading questions. That's kind of a little bit of a leading question. Like in that example, you're automatically assuming that the person wanted to lose weight or that they have a perspective of their own that they've lost weight or that they look a certain way. So I would more be open-ended. If somebody came in and they clearly lost weight, I would kind of just, you look different. Has anything changed?
Mm.
And just take a curious approach. Like, Connor, if I'm sitting here talking to you about your life, you want me to be curious and inquisitive and ask good questions.
Well, that depends on the
Um,
day.
well, that's true. If you're in an open mindset and you really like, we all get walled off and just don't want to deal with other people or don't want to have a conversation at times. But if you're already open to talking and I'm asking, about how you're doing or what you're up to, like we want depth. We want people to care about us, right?
Yeah.
So in the treatment situation, that's what we got to do primarily is let the person in front of us know that, hey, I care about, it doesn't even have to be you. It's just like, I care about humanity. I care about doing the right thing. That's what I'm going to try to do with your care as well. And that comes first and primarily through understanding who you are and what you're dealing with.
I wanted to read this one out, and then I also have a follow-up question for you as well. More cuddles, please. Says, my ENT casually said that I could get my anxiety checked out. He was very certain I had it, and I've never been diagnosed for it. Turns out he was right, and he really saved my mental health. Someone responded, that seems like a medical professional advising you to seek treatment for a medical problem outside their specialty. Sounds pretty appropriate, honestly. And so my follow-up question for that was, have you ever discovered a possible alternative medical issue with one of your patients that is outside of your specialty?
Oh, absolutely. I think primarily our job as psychiatrists, number one, like when we're trying to diagnose something, it's rule out that there's something medical or what we would call an organic cause. Anxiety could be related to an overactive thyroid. A friend of mine, his wife was giving birth to their second daughter, and he's standing there and he was so anxious, which is not super typical of him. But he's there during the birth and he ends up, I think, like passing out or something. And he has to get admitted to the hospital. Well, they find out that his thyroid is extremely overactive. He's in a what's called a thyroid crisis, just to keep the term simple. Anxiety is not even its own diagnosis, in my opinion. Anxiety is a symptom. Now, of course, the DSM lists generalized anxiety disorder as a distinct diagnosis, but there's no data or evidence or validity to that. We all deal with anxiety. So we've got to make sure that we're not just throwing our shotgun approach with medication, But first, we're doing a thorough workup if somebody hasn't had one. We're checking electrolytes, iron studies, vitamins, and minerals. I do some other things where I check some things kind of off the beaten path, like magnesium levels, checking things like fish oil or omega-3 ratios. If somebody is psychotic for the first time, they should have an MRI of their brain. That's the standard of care. It doesn't always happen, but we've got to rule things out first. I've seen people who have an excess of copper in their blood, which is associated with anger and irritability and anxiety. In terms of this ENT, casually dropping that I think you have anxiety. Yeah, I mean, I think that could be a good thing. It could also be a bad thing if they just refer you to somebody who's going to shell out pills and do that 15-minute appointment thing and say, oh, yeah, I know how to do this. I just prescribe an SSRI and wipe my hands clean of it. To me, that's not treatment, and that's how it could go poorly. But if that person then gets to a good psychiatrist or therapist that can help them manage their anxiety without just numbing it, yeah, that's great. That's perfect. Maybe the NT notices something that hadn't been noticed by their general practitioner. Just a real quick aside here, this prompt speaks to a bigger problem in the US. We're all specialists. Almost 90% of us are specialized. That leaves, I think it's like 12.5% physicians that end up being primary care doctors. The lowest percentage in the world, I think it's Germany. I'd have to go back and look, but it's like 25%. And the vast majority of countries throughout the world have rates of primary care physicians compared to all other specialties at like 50% or higher. So what does that do for the medical system as a whole? Well, it means that care is really disconnected. Most people don't have a good primary care provider that has an understanding of all of their health and the different specialists that they see. That's a major problem. It is something I think that psychiatrists should be more aware of and try to help people navigate the system and help them understand that. Not so much necessarily try to treat an OBGYN condition, or certainly not going to be doing any surgery, but it's a fundamental issue with our healthcare system that everybody's disconnected, and the ENT is not going to prescribe you something for anxiety. They're going to shuttle you off to a different specialist, a psychiatrist, and it may be 3 or 6 months before you get in to see them. So this disconnected, disjointed, everybody's a specialist creates a unique set of problems that I think are worse here in the US than other countries.
All right. I think your conversation on anxiety being a symptom as opposed to a diagnosis, I think that leads pretty well into this next question from r/ask Reddit. Soapy Fork asks, sorry, that name is just hilarious. Soapy Fork.
Soapy Fork.
Uh,
I don't know why that's funny, but it is kind of gives me a little chuckle.
People with mental health disorders, what is one common major misconception about your disorder? Metal Maiden 420 says, I have severe anxiety, so much it's developed into agoraphobia. I stay in my apartment most days, and I only really go outside in public accompanied by my safe person. Common misconception is that I'm lazy and I don't have a life because I stay inside all day most days and I'm content not leaving. But I do a lot. I draw, I'm learning how to sew, and I try to get out a little more every day, but it's baby steps. They also clarify to people who think that I'm lazy because I sleep a lot, I have regular panic attacks, at least 3 times a day, and it's rather exhausting. My brain feels like it needs a rest after having one.
So let me comment on panic itself. Steve Hayes has some great information on panic disorder, a lot of it discovered through his own experience with panic disorder. But he talks about it in, I think, just a good general sense of the more you try to control something like panic, the less control you have over it. Or as a previous guest, Jim Murphy, would say, whatever it is that you idolize, that will also be the thing that scares you the most. So if you idolize your look or your beauty, then you will always fear that you are ugly. If you idolize being in a sense of calm, then you will always fear that you will panic. Panic disorder, like I just said, there's other causes, there's other contributors to it, there's other mediators of what causes panic. But fundamentally, I think one of the most major misconceptions about panic disorder, since that's what this prompt is kind of about, is that you can escape your symptoms through avoidance or that you can somehow escape your mind. And this person, Metal Maiden 420, kind of alludes to that. They've become more isolated and withdrawn, but they're still having panic attacks. So they get this temporary relief from isolation and the sense like, I don't have to go out, so now I'm not that anxious. But because they're trying to hold that anxiety out here and not even look at it, because that might make it more real, because they worship this sense of feeling calm. I'm guessing with the 420 that they may also be using THC, which again, it may help temporarily, but it may worsen things in the long term.
In my experience, it is not helpful.
And it's person to person. It's very
Yeah.
dependent on each individual. I certainly don't think, all this bullshit with 99% THC vape pens, that's not normal. That's not natural. And that is not a medicine. That is not therapeutic. Most of the benefits of marijuana come from the CBD, at least in the research base. But even within THC's potential therapeutic benefits, it's not about maxing out the THC percentage. That is very unnatural. It's like 30 to 40 times stronger, more potent than what is naturally growing in the ground. So
It's like taking 5 of your SSRI pills in a day because you think it's just going to be more effective.
exactly. And then you're getting to an overloaded or an overdose. A great example of this, I read an article this morning. What was it called? It was called like Feel Free. Have you heard of that?
I have not.
Feel Free, or let me see if I can just real quick. Okay, yeah. So it is Feel Free. Oh my gosh. I was reading this article about this gas station drink that is out there called Feel Free, and how somebody was walking into a convenience store and this 14-year-old outside was like fiending. And they were like, hey, can you buy me some of this? And it's right up at the counter. Well, it's a mix of kava and krava,
Ava. Yeah, okay.
both of which are natural plant derived substances, both of which may have some medicinal properties, but not in that bullshit version Feel Free. Feel Free is this totally adulterated or potentiated version of what the natural plant is. And you'll see it there. It's got 7-hydroxymitragynine. So they take out some of the psychoactive parts of the natural substance and they create a new synthetic version of it that is nothing like the normal plant. It's similar to cocaine, right? Everybody knows the cocaine story. People used to chew on coca leaves as they were working and get a much slower and less potent release of the psychoactive part, cocaine. But when you take that out of the plant and you create this extremely potent version of it, it's really bad for us. So, these things are happening all over the place with our drug supply. This stuff is scary, the Feel Free, because it's sitting in the gas station. It's like, what are we doing?
I find this a little unusual how there's actually 2 servings per container. I don't know why they wouldn't just dilute it to half of its potency and sell it as like a 1 serving bottle of this stuff.
No, it's you always got to look at the servings per container. Something will look on the health food aisle, it'll look really healthy, and you look and it's like, oh, this has 35 servings. So yeah, it's only 4% of my added sugar, but if I have 1 actual serving of what I'll eat, that's going to be 70% of my daily sugar intake. True mitragynine, that's a plant native to Southeast Asia. There, at least for a time, I don't know what's going on with it in the last few years, but for a time, kratom mitragynine has some properties that make it function as more like an opiate, and it has some properties that make it function more like an amphetamine. It may be a useful tool for coming off of amphetamines. I know they use it in Southeast Asia in some cultures to try to get off of methamphetamine, which is a huge problem in Southeast Asia, or to come off of opiates. And the potential benefit of the actual mitragynine plant, the potential benefit of it is that it doesn't cause respiratory depression like opiates do, or a lot of opiates do. So similar to buprenorphine or Suboxone, it doesn't cause the person to stop breathing, which is a huge protective factor when it comes to overdose. That's how people die from heroin or Oxycontin or different opiates. But the substance is now just kind of demonized because it's got so many bad actors pretending to be kratom. But in reality, they're not kratom. They're this ultra potentiated version of it, similar to what you find, to bring us all the way back around, in a lot of the THC products today. I mean, it should tell you something that people have to go to medical dispensaries to get low potency THC. They can't even get that in a recreational dispensary. It's insane.
This question comes also from Ask Reddit. It's similar to a previous question. Doctors and nurses of Reddit, what are the biggest health misconceptions people should know about? Dairy Queen Latifah says that people have no control over their diagnosis or course of action. Most people aren't aware that as patients, you have more rights sometimes than nurses do. People don't speak up and make themselves heard because they think that we won't listen. We have to listen unless there is a very serious reason for us not to. And M Baby says one of the biggest misconceptions is that medicine and counseling is the most effective way to combat mental illness for everyone. The social determinants of health, such as poverty, are undervalued in the traditional medical model despite the evidence base.
I think the biggest health misconception people should know about is that for the vast majority of problems, you don't have to do anything right now on the treatment side. And that's when I say, like, you don't need to seek out a fix me now cure. Now, there are obvious exceptions to that. You have an infection that's sensitive to a certain antibiotic, then you want to go ahead and take that as soon as possible so it doesn't get worse, right? You have a tumor that is affecting your thyroid and you're producing all kinds of thyroid hormone. You very well may need to get that tumor cut out now. But just like when we have a lot of problems in life, we can get into trouble by rushing to try to fix it, by rushing into treatment. Cardiac stenting is something that's come up on the podcast before. If there's any blockage in the arteries of the heart, it intuitively makes sense. So, well, I want to clear the blockage, right? If you don't have any symptoms, or if you have, potentially mild enough symptoms, it may not be something that you want to pursue. There are unforeseen risks of stenting that may outweigh the benefit that you could get. And you may be establishing what's called collateral forms of circulation, arteries growing around the blockage. Things are, a lot more complex. A lot of the time, what we need to do is gather more information, get more labs, get more data, get more collateral before we jump into trying to find the answer and the fix. Because often there's also not one fix for things. It is your symptoms are at 90 out of 100, and we're going to try X, Y, and Z to bring you down to 80 and then 60 and then 40. Or we're going to make these lifestyle changes and see where you're at in 6 months. Like a good example is things that may be found on MRI or imaging of the brain that have nothing to do with the symptoms you're having, but now you've located something and you feel like you got to treat it. That's called an incidentaloma. So, you don't always, in fact, most of the time you don't need to treat. That's, I think, where the system's gotten so big. And obviously, treatment means that you're probably going to come back, and treatment means that you're going to pay into the system more and more. But a good doctor or nurse or provider will really emphasize when we need to be cautious about treatment. So that's I think, a fundamental misconception that is wired into our brains at this point because of all the crap that we see on TV and advertising, marketing. Like, we have this ability in the United States that doesn't exist elsewhere around the world, that we can just fix everything here. No, that's just not the case. I mean, we've got to be better at that. So, yeah, not everything is abnormal. Sometimes your abnormalities are evolutionarily, or in terms of the group that you interact with, their benefits. It's beneficial for some people to have these symptoms of ADHD in terms of the group. It's beneficial to have people in your group who don't have an IQ of 140. It's beneficial to have some people with low IQs that are really physically capable, or people that have insane ability to remember and recall things, but can't socially communicate very well. We do best in these group dynamics. Not everything's abnormal. Not everything needs to be treated. And absolutely, to Dairy Queen Latifah's point, yeah, you get to make the final decision on what you do with your life, your brain, your body. So don't let anybody tell you otherwise. You get final decision-making power. So,
Disclaimer. This podcast is for informational purposes only. The information provided in this podcast and related materials are meant only to educate. This information is not intended as a substitute for professional medical advice. While I am a medical doctor and many of my guests have extensive medical training and experience, nothing stated in this podcast nor materials related to this podcast, including recommended websites, texts, graphics, images, or any other materials, should be treated as a substitute for professional, medical, or psychological advice, diagnosis, or treatment. All listeners should consult with a medical professional, licensed mental health provider, or other healthcare provider if seeking medical advice, diagnosis, or treatment.
Or, put more simply,
If you need help like this guy, call your own doctor.
Thanks again for watching and or listening. If you're passionate about the subjects that I discuss on the channel, do me a favor and like, comment, subscribe, do whatever you can to make your voice heard, that these are problems that must be addressed in our society. If you have any questions, comments, or concerns, I want to hear them. Feel free to reach out on social media or email us at renegadepsych@gmail.com. And if you'd like to be a guest of the show, or you have a connection to somebody that you think would be a good guest, let us know. Thanks again for listening.